Hello, everyone. Welcome to our monthly Springboard Get Pitched event. We're very excited to have you on today. And we've got three very exciting and innovative companies to present to the group. Fruit Street, Tasuna, and Kumba Health. They'll all be conducting a 15-minute pitch and Q&A. Before we get things started, I just want to kick off a few housekeeping items. My name is Lyle Martin. I am the CEO and founder of Springboard Equity. Today, we're also conducting this event for the first time in partnership with a new organization called the Physician Capital Network. And we're very excited to have all of our members from that network joining on today's call as well. As I said, we've got three companies to be presenting to you today. What I would ask is that if you go through the next slide, please. We do have a disclaimer. All the information provided by these companies is respective and independent for themselves. As an investor or potential interested party, please conduct your due diligence. We will be happy to connect you with each of the presenting companies. So at the end, you'll see several different opportunities with an email to connect with us, and we're happy to connect you with the presenting companies. In addition, you'll see on the right-hand side of the screen, there is a chat feature. Each presenting company will have a 5-minute Q&A session, so please provide whatever questions you have, just type them in there. We're consolidating those questions, and we'll have time for 3 or 4 questions for each group, so please do not hesitate to type in your question there. And again, we're very excited to have these companies today. So our first company we're going to kick started is Fruit Street Health. And I'm going to turn it over to their CEO, Lawrence Gerard. Lawrence.
Hi, thanks for having me. So Fruit Street is a telemedicine software product that is licensed to healthcare providers and allows them to do HIPAA-compliant video calls and monitor their patients' health and diet and lifestyle using medical and wearable devices like FDA-approved blood pressure cuffs, glucometers, weight scales, Fitbit, and an app where patients can take pictures of their food. And Fruit Street's mission as a for-profit public benefit corporation is to prevent and treat lifestyle-related disease using telemedicine, wearable devices, and mobile applications. Next slide. And so the product, it's a software as a service that we license for $200 per month to the practice. Practice can put their logo on it. It allows them to do HIPAA-compliant video calls again. Each patient has a personal health record that integrates with Fitbit products, so you can monitor physical activity, sleep, weight, and then eye health products for blood pressure, glucometer, and weight data. A web portal where patients can schedule, pay for appointments, do secure messaging as well. And so there's one interface for the patient on a website. There's one interface for the provider on the web in the cloud. And then there's a mobile app for the patient. And we will also have a mobile app for the provider. And so we license this to the provider, and they can use it with patients in their practice. Next slide, please. So this is just a preview of the mobile app. So we have an iPhone and an Android application that allows patients to conduct HIPAA-compliant video calls, schedule and pay for appointments, view their wearable device data from Fitbit and iHealth Labs, take pictures of their food as well, and see goals at their healthcare provider. Next slide, please. And so again, the business model is software as a service for small to medium-sized practices. It could be a primary care doctor, cardiologist, bariatric surgeon, dietitian, endocrinologist. It's lifestyle-related specialties, but even things like cancer survivorship and corporate wellness, for example. And so for a small practice, we charge $200 per month. And the idea would be that if we had 5,000 providers paying $200 per month, we would have $12 million in revenue. And SaaS companies typically get acquired for 10x their revenue, so we could have a $120 million exit to a company like Fitbit. But we also have enterprise contracts where they could pay upfront $250,000 to $1 million. And these are organizations like DaVita Kidney Care, for example. Next slide, please. And so when the provider licenses the software, there's a few ways they can use it from a revenue perspective. One is that the patients can just pay out of pocket. So we have Stripe integrated for payment processing. So the provider could say it's $50 to do a video visit, and every 2 days those funds are deposited into the practice's bank account. There's also 33 states that have parity laws requiring private insurance companies to reimburse for telemedicine. So you can be reimbursed for telemedicine, and that legislation is rapidly improving including Medicare reimbursing for the diabetes prevention program online in January of 2018. Things like accountable care organizations where they're looking to improve healthcare outcomes and reduce costs. Insurers where there's an insurance company in Europe has dietitians call patients once a month after they have a heart attack or stroke, or even self-insured employers where they might be using Fruit Street with a healthcare provider to prevent diabetic from becoming a type 2 diabetic patient as well. And so there's a variety of financial models that the software can be used in, including value-based contracts. Next slide. So, currently there's a little bit over $100,000 in total revenue, around $15K a month of revenue. There's around 300 practices that have signed up and paid, and we've been experimenting, with the pricing, just focusing on getting users. But our 12-month goal is to have $200,000 a month of revenue, and we have some very significant institutional leads, some of which will close within the next 2 weeks. For example, the most promising one is DaVita Kidney Care. They're going to be using the product on DaVita.com, which has 50,000 unique visitors per month, where they'll have dietitians work with chronic kidney disease patients. We quoted them a $800,000 upfront contract to private label the entire Fruit Street mobile app with their logo and do some customization, becoming an equity investor. Another lead is Sodexo, where there's 4,000 dietitians employed, where they want to use the product for corporate wellness. The follow-up call this week there has 400 dietitians. They actually asked for a quote to buy 400 licenses. MediWeight Loss has 100 medical weight loss practices, which is another one. Oncology just did a call with today. They want to use the product for cancer treatment for dietitians, social workers, and psychologists. Already got approval from Aetna and Cigna to get reimbursed, but also use this for cancer survivorship. And Fitbit is actually recently hired a new VP of digital health, where they're highly interested in telemedicine and possibly doing some co-development with us. They're also considering being an investor. And we'll also be funding a clinical trial at Mass General starting in January, which we'll discuss at the end. But these are the 12-month revenue goals. We break in about 12 months. The next slide, please. And so the way we do the market sales is through LinkedIn, because about 75% of all healthcare providers are online in the US. And so we'll do cost per click advertising, where we're paying between $5 and $10 a click for the physician to click an ad where they see medicine software. So if we spend $50,000 in a month on LinkedIn ads, we'll have between 5 and 10,000 healthcare providers click the ad, come to fruitstreet.com, where our goal is to get them to fill out a form with their name, email, and phone number, at which point their data goes into our customer relationship management software, and we follow up and close the sale. So every day we have 20 to 30 healthcare providers come to the website. We're constantly following up, and we have a backlog of leads right now. Next slide. But we're also using LinkedIn to raise capital. So we've raised approaching $6 million from 160 physicians. And so we do the same type of advertising for physicians, where we're paying $5 to $10 a click for physicians to come to the website and express an interest in investing, where they ultimately invest between $25,000. Many of them also use their IRAs or 401ks to invest. So we've actually raised an average of $250,000 per month this year, and the company was formed in May of 2014. So our goal, just $25 million would be that we could have 100 physicians invest an average of $50,000 each, instead of being funded by an institution, and could have these physicians shares to be in a medical think tank. Next slide, please. So Fruit Street team, so I'm the CEO and co-founder. I was a pre-med student at the Harvard Extension School in Boston, had a previous company, I raised $1 million. It failed during, and then we restarted it as Fruit Street, offered all the old investors for shares in the new company just to be ethical and make sure they got a return on investment. And at the beginning of Fruit Street, we partnered with VC company, and Milton, who's my co-founder of Fruit Street, did his PhD in computer science at Stanford. Chris is our full-time legal counsel and CFO. He is an attorney. He graduated Harvard Law School 40 years ago, shut down his practice to do this full-time. Drexel Medical School and runs the sales team. And Asif is a cardiologist at the University of Texas, who was the first investor. We also have a digital advertising agency, Bigger Hostetler, and a PR firm involved. Next slide. So really the core reason why people are so confidently investing is our partnership with VC. VC was founded in 2008 by Milton when he was at Stanford. And originally they got a $1 million grant from the National Science Foundation, followed by venture capital funding from In-Q-Tel, which is the CIA's venture capital firm. Their primary investor. And they're most famous for being the video software selected by NASA on the International Space Station. And our agreement is that VC gave us a license to the patented video technology, but agreed to build 100% of the product going forward. And is that Fruit Street gave to VC through this joint venture agreement 10% of the equity that they're earning over the course of 10 years. Revenue 50-50 with a maximum of $1 million per month. The thought process being that if we eventually in 6 or 7 years had 50 million in revenue, but they increase the size of the software development team as things progress. We also take 50% of the equity investment that we raise, we advance it to VC as a credit against future revenue sharing. Milton Chen is on our board of directors, publicly listing himself as CTO and co-founder. And so because there's no minimum payments required in this contract of guaranteed software development from the market leader in the telemedicine industry, which means for Fruit Street investors to lose their money, VC would have to cease to exist, which is very unlikely. They have 55 full-time employees. Next. And so again, VC was the video software selected by NASA because it's the most bandwidth efficient video software in the world. Next slide. VC customers. So VC is the video software used in the Walgreens mobile app, used at Sutter Health, Intermountain Healthcare, Partners Healthcare. And VC is now promoting the Fruit Street product now that it's more developed with their existing customers. And so they have some of the biggest names in healthcare. And so they're not just building the product, but it's an amazing business relationship. The two companies are one company. Next slide, please. Actually putting on a combined user conference in San Jose, where we study the telehealth failures, successes. So see, these are some of the names coming. So like the head of telemedicine at Microsoft, Salesforce is coming, MD Live. And so now that the Fruit Street product's developed, we're going to be promoting Fruit Street with these institutions who are existing VC customers. And the difference between VC and Fruit Street is that VC focuses on being a video engine and kind of like a medical video product, where Fruit Street focuses more on and diet and lifestyle interventions, and how do we not just do video visits, but combine it with wearable devices and mobile apps to do behavior change. And the VC team, so I mentioned Milton, his PhD advisor at Stanford was Professor Terry Winograd, who was the same advisor that Larry Page started Google. The other advisor, David Kelly at VC, is co-founder of Stanford Design School, was one of the primary mentors. And Steve Chang, who's the head of engineering at VC, was co-founder with WhatsApp co-founder at Stanford. Really some of the best designers and engineers in the industry. So have very good user experience, knowledge. Was also one of the co-authors of the XMPP video standard used by Facebook and Google Chat. So our funding history, we were founded in May 2014. Originally raised $1.8 million at a $5 million valuation, so 48 cents per share. Then we raised $1.6 million of long-term debt, where most of the loans are 4 to 7 years. Investors have very friendly debt. And now we've raised $3.5 million at a $10 million valuation, or 66 cents per share, and we're accepting another $500K at this valuation at a $25 million valuation. And again, we've been raising about $250,000 per month. So we're one of the best companies out there in terms of the ability to raise capital from physicians. And they typically, again, invest 25 to, next slide. And so, again, this physician crowdfunding model, they act as a sales network. They give us advice. We have a digital form software set up, acting with our physicians, getting input. And if we needed to, again, raise $25 million, we do that from 500 physicians investing $50,000 each. Next. And we're conducting a clinical trial in January at Mass General, where they have a weight management program. They're doing almost 50% of their visits. So instead, we're doing this online. Fitbit will likely be donating the devices to the study. And we're trying to prove that if patients do dietitian visits online, they'll miss less appointments, they'll lose more weight, their cholesterol will improve, their blood pressure, their hemoglobin A1C. Investigators is a cardiologist, the other is an economics professor at MIT. So we're doing this to prove the effectiveness of the Fruit Street model, but there's already existing telemedicine programs, like at the VA, they have the Telemove program. It's very successful for weight management, but we just want to do study with our own product as well. Next slide. That's it. And so I'd be happy to give a one-on-one 60-minute presentation on our telemedicine software with anyone that's interested. Normally I do one-on-one presentations and I introduce you to 3 of the key executives in the company, including Milton, spend a lot of time one-on-one with each investor. And so questions.
All right, thank you, Lawrence. I apologize, we had a little bit of an audio connection. We caught about 96% of what he was saying there, but we saw the video as well, so I appreciate that. So the first question, we do have a few, so I would remind everyone that you can type in your questions into the right-hand side on the chat box. So the first is, it's kind of a combination of 2 different questions that are similar, but it states, what do you believe your company or how your company differentiates yourself from other telehealth companies out there today, such as Teladoc, MDLive, American Well?
So Teladoc, MDLive, and American Well are really in the business of healthcare services. For example, a consumer can pay $50 to do an internal medicine visit, or there's insurance reimbursement. Fruit Street is not in the business of healthcare services. We do not employ healthcare providers. We license care providers to enhance their existing relationship with their patients around lifestyle-related use cases like bariatric surgery, medical weight loss, diabetes, heart disease. And we don't just license video software. We take it a step further, where we integrate with the wearable devices. We have an app where patients can take pictures of their food. With Harvard Health Publications, where we're sending content to the patient's phone. So we're going beyond video visits only. That's the old version of telemedicine. The new version of telemedicine will have more wearable device integration, content, and push notification reminders in the mobile app. And so instead of doing kind of more of a comprehensive focus.
All right, next question. What is the acquisition plan? Could it be Fitbit or another wearable device?
So we've been working with Fitbit for 1 year, doing weekly calls with their senior executives. We were a speaker at their corporate wellness conference titled, "Can Wearable Devices Improve Healthcare Outcomes?" And we're integrating a store into the telemedicine portal where if you're a cardiologist and they tell you, you're overweight, you have hypertension, you're at risk for diabetes, you go home, you sign up for the telemedicine portal for working with a dietitian, for example, you'll be able to buy the devices. Quarterly earnings calls are actively going into healthcare. Their CEO just announced they're totally shifting the whole company into healthcare. And so we could be a distribution channel for their devices, but they also want to prove through clinical research, clinical trials that they're interested in that. And we are in discussions with the VP of Digital Health that Fitbit just hired, Adam Pellegrini. He was actually responsible for integrating VC, our video software, into the Walgreens mobile app. So you have a close personal connection to very senior executives at Fitbit.
All right. I think at that point, we're going to wrap up Fruit Street. We will consolidate other questions that come in for Fruit Street. In addition, you'll see on the screen right now, there is an email, info@springboardequity.com. Feel free to submit your questions there. In the subject line, if you could indicate for Fruit Street, if that is the question, the name of the company in this case, that would be appreciated. At this point, we will move on. Thank you very much, Lawrence. Appreciate that. We'll move on to our next company. And at this point, I'd like to introduce the CEO, Prashant Jain of Tasuna. Prashant.
Thank you all for having me. I'm Prashant. I'm representing Tasuna. Can we go to the next slide, please? So Tasuna is, the vision of the company is like help people live healthier lives through connected devices. So Tasuna is like a wearable device, like a Fitbit or any healthcare band which you see, but it has a totally different functionalities. We are focusing on top 3 causes of morbidity of heart disease, lung disease, and diabetes. And none of the devices exist in the market capture any of that in one singular form and on a real-time basis. So our device is going to capture all the data in a real-time basis. Next slide, please. So total available market for all these 3 diseases combined is 464 million as we speak. Serviceable available market in US is around 48 million. Target market is around 35 million users, or the patients are there. and worldwide total available market is target market is around 300 million. So if we take a 10% of it and capture that, it's around 3.5 million a year. We are targeting in US and around 30 million users worldwide. Can we move to next slide, please? There are top 3 current problems which we are dealing with is doctors cannot monitor patients in their natural state, opaque view of patients' medical history, and family members can't keep tab on their parents' well-being. So if a patient comes to a clinic, what happens is you take vitals of that patient, EKG of that patient, blood glucose of that patient at that point of time, but it is always a snapshot, not a real time. So we are taking a step ahead and doing all the detection and intervention at a real-time basis. Next slide, please. So these are just the sample pictures of the device can look like. What we are doing is it is a very unique one. It's not a plasticky or any rubbery kind of band. We are making it more like a jewelry so that the people can use it, wear it on a regular day basis. They can take a shower with it and all that stuff which they wanted to do on a regular normal life. It has 3 main functionalities which we are starting with. It will record EKG, ECG in a real-time basis. And if there are any abnormalities gets detected during the real-time basis, it will shoot out the alerts to the patient's relatives, not to the patient, because if the patient is having a heart attack, then definitely that patient is not going to do anything at all. So that's how this device is getting or sending all the notifications out. It is taking blood glucose levels as a snapshot, and eventually we want this device to give the blood glucose level at a real-time basis as well, but need some modifications on the sensor side of it. And definitely blood oxygen level in the blood, it records on a real-time basis. If it drops, it will connect with your oxygen cylinders or any of the devices which are outside of the range. It will get connected to them on a Bluetooth or other connections, near frequency chip or other kind of technology, which will push out the notifications and increase the blood oxygen level or supply of the oxygen higher. Next slide, please. So our revenue model is we are going to sell this device at $199 upfront cost to the customers, and we are going to charge $9 monthly subscription fee. We are keeping this as a Netflix model so that people, once they are logged into that or once they subscribe it, there is no need to go back, like they don't cancel the subscription. So that is the model we are going with. And we are also providing an emergency 911 alerts services where, like, if some abnormalities gets detected, then our device will send out the notification to our customer service center as well as to the external to the patient's relatives, and we will do 911 call and call the patient also to figure it out whether they need help. If they need help, we will send out the emergency services. And also the data we will collect, it's a real-time basis data, so that data is more valuable to the pharmaceutical and insurance companies for future business growth. Next slide. Our marketing strategy is 3-pronged approach. First is business to consumers, direct social digital marketing, adult daycare centers, offline physical marketing channels. We are going to use all of them, and also doctors' offices and hospitals. Second is business to business. We are going to approach Fortune 100,000 companies so that they can push these devices to their employees and for their health benefits. And small tech startups and medium-sized companies, as you know, tech startup companies are always more eager to adapt new technology, and they care more about their employees. So we will approach them, and definitely AARP. And business to a government is Department of Defense, Public Safety Department, state government, public sector, and non-profit government and private sector. They all are all over in the marketing strategy growth. Next slide. Next slide. Yeah. So release timeline. So what we are looking for as of Q4, we are looking for 500K as a seed funding to create MVP and go for the preclinical trials. And the Q1 next year, we are planning to have our pre-series A part 1 or T1, where we are going to release the alpha version among the family friends and go for around 200 to 500 users as a clinical trial to refine the logic behind it so that it detects and all the abnormalities during the data collection. In the Q3, we are going for a 5 million round, and also for the team scaling, acquisition, market acquisition, operations expansion, and full-fledged launch of the product all over US. That's our goal for the next year. Next slide. We are raising, as I said, like the 500K in seed funding. This is for the technology product development, hire key employees, and because it has just not the software part of it, which needs a lot of refinement, logic creation and all, but it also has a hardware developments on the side of it. So we have to work on both the sides. And also on 2 million, which is on Q1, we are looking to increase the sales and marketing, legal IP work, team scaling, increase production, and also a limited availability of the product, and the clinical trials. Q3, 5 million, which we are asking for, is for the PR activities, press release, final product launch, and cash burning for the early consumer acquisition. So that's how our funding is going to get used. Next slide. So in financial plans, definitely until next year, July, it's all in our product development, clinical trials, and also the product refinement of it. But after that, once we start acquiring the consumers, we will see the revenue starts going up. And in the second part of it, the right side, it shows 2017, how much we are going to make a revenue and the net profit. 18 and 19, definitely we are going to achieve a lot more, which is around 400 million in revenue, because it is a subscription-based model. So what is happening is, even if we capture, say, 10% of the market, the regular income is going to start coming in. Next slide. Exit strategy, definitely medical device manufacturers are interested. They will be interested. IoT device companies like Fitbit, Apple, Samsung, they will be interested in us. Pharmaceutical biotechnology firms, they will be getting into this one as well, because it's all synergy between the device and the diseases. And these pharmaceutical companies for the further development of the new products for themselves as well. And we can also go for IPO based on how the company or the product does. Next slide. In the competition, if you see currently Apple Watch, Fitbit, Samsung, Garmin, and any other devices, they all are doing more or less the same thing. None of them are doing EKG monitoring. None of them are doing blood glucose monitoring. They are doing heart rate, sleep patterns. We are going to do or provide everything whatever the Fitbit or Apple Watch is providing, but on top of that, we are targeting all the three main components or the functionalities which our main device is doing it. And we are also providing GPS location tracking. Suppose a person is hiking somewhere and he start getting a panic attack, or like getting a heart attack, or any of those kind of abnormalities, and based on the location, the longitude and latitude, we can definitely send a help at that location for the patient for the prevention of any other, for the treatment or whatever is needed. So that's what our device is going to do. And second of all, our device is not dependent on phone at all. It is an independent device. It has a SIM card attached to it, so it will be connected to cell phone towers independently. So if you have a smartphone, don't have a smartphone, it doesn't matter. Your device is still connected, and your data and your health record and your current monitoring will be getting transferred directly to our servers. Next slide. So This is our management team. I'm Prashant, and I also launched a couple of years back a telemedicine company called Dr. Insta successfully in India. It was the first telemedicine company in India, and we also tied up with the country of Brunei, who are launching Dr. Insta as a nationalized healthcare telemedicine service in the whole country. And they will be launching it by end of this year, early next year. As we speak, it is going on as for the customer localization of the product. Rani Sultan is our CFO. She's also present in this meeting, listening. And Mrinal did his MBA from HEC Paris. He's working on the healthcare sector with Baxter Health and other companies on the strategy side of it and operation side of it. Siddharth Mehta is again MBA from HEC Paris. He was working on the strategy side of it for the logistics companies, as well as a bunch of startups in America, Europe as well. Vishal is our business development person. He's based out in Bay Area. Next slide, please. Any questions?
All right, Prashant, thank you very much. We do have a few questions, so we'll get to a few here. The first comes from Michael. From a technical standpoint, how does it monitor the blood glucose levels?
So it is going to get connected with, there are two sensors available in the market. One is through the Abbott labs, and the second one is from Medtronic. They got placed in the tricep area, and they stay there between 3 months to 6 months. And none of these sensors are available in the market which do non-invasive blood glucose monitoring. So we are going to work with those sensors. Our device is going to connect with them as a NFC or as a Bluetooth connection, so that they keep on sending the current blood glucose level to the device. And that's how we are going to monitor the blood glucose levels. But definitely in future, once we grow, like say in a year or so, definitely we want our own engineering and R&D team who will be working on non-invasive, not just the blood glucose sensors, but other sensors related to your endocrine systems, your hormonal systems, which will detect all those levels without even interfering or going invasive.
All right, and also related to that, a question is around, to date, what studies or testing has been completed regarding the efficacy or correctness of those blood glucose monitors?
So, and all the blood glucose monitors which are available in the market, they work on the FDA guidelines. So we are not going to deviate from those guidelines at all. Even though our plan is not to go through FDA for clinical trials or going for any those legalities of red tape, but definitely we want our product to be as close possible as to the FDA guidelines. And as it is still a consumer device, not a medical device, so we are not going to take responsibility on the side where we say that we are diagnosing everything properly, but we definitely give as accurate possible results as possible, so that if there is any abnormalities and if our device spit out a result saying that these are the differential diagnoses, you might reach out to your doctor immediately, then definitely there are some abnormalities and you can get a preventive care immediately.
Okay, next question from Dr. Greg Buford. This is around more on the safety side of it from a data. How do you plan to reduce the risk of hacking of information sent from this device?
So we are definitely going to use the current security measures, encryption methods, and we are definitely not sending out any information which is personal in nature to anywhere else. We are not selling it out. It will be your current medical or your latest medical history, which we will have it. But definitely we are going to take care of all the security measures which are available for the encryption right from the device all the way to the cloud and anywhere it is going. And we will definitely keep in mind that patient has the control of their medical history and medical data. Whenever, wherever the patient needs this thing to go, we will do it. But otherwise, we are not going to sell it or do anything on those lines.
Okay, question around insurance. Will payers such as Medicare, Medicaid, or commercial private payers pay for this service?
Our plan is definitely within a year of the launch, when we will definitely go to these insurance companies, Medicare, Medicaid, so that this device is going to be available through those insurance companies. But it's a business game. Like, if we grow big, then definitely they will be interested. As you know, the Apple Watch is going through the insurance companies, and they're providing Apple Watch free of cost to those consumers. So eventually, our goal is definitely to go through them.
Okay, and last question. We have many other questions. We will consolidate those and get them to Parshant, and he will respond within 24 hours. But for time's sake, last question here on the call. Is this a smartphone dependent device?
This device is not a smartphone dependent device, because it will have its own SIM card. So the device will be directly connected to the cell phone towers, and it will sending out all the data independently. But definitely for the monitoring purposes, we will have an app. Suppose your parents are living in Orange County, and the kids are living in New York City or in Sweden. They will get the exact real-time data on the apps on their smartphone. So they will know that if there is something wrong with their parents' health, they will get notified at that location, and they can call their parents or whatever they wanted to do for further action. But definitely this device is totally independent, because we know that, like, the baby boomers, they are not very technology friendly. So we wanted to keep this device as simple as possible. They can take a shower, wireless charging, 30-day, you don't have to even charge it for 30 days. So all those things are in place, and we don't want a plasticky device, because people don't like it, wearing a rubber band or a plastic band. We are making it more like a fashion accessory jewelry, so that they can wear it with their evening gowns. They can go to parties, or even when they are like taking a shower, it will work. So everything is good to go with that part.
All right, fantastic. Thank you, Parshant. Appreciate it. Again, we will get back. There's other questions. We'll consolidate. We'll get those over to Parshant, and he will respond in the next 24 or 48 hours. Thank you, Parshant.
Thank you.
We're going to move to the final presentation of today, Kumba Health. And to present on behalf of that group, Mr. Jay Goss. Jay.
Hi there, everybody, and thank you to the team at Springboard Equity. We are Kumba Health. Another time when I have more time, I'll answer the all-important question as to what Kumba means. In the meantime, I'm Jay Goss. I'm the Chief Operating Officer of Kumba Health. Next slide, please. So what is Kumba? We are an online marketplace that brings together healthcare providers and consumers or patients. On the consumer side, we enable the consumer to look, book, pay, or save, which means they can go to Kumba, they can find a provider, they can schedule an appointment with the provider, they can in fact pay for that service or procedure, and along the way they save money. On the provider side of the marketplace, we enable our healthcare providers, which include doctors from all different medical specialties. It includes imaging centers, labs, even urgent care facilities. We, in essence, provide them a way of getting direct pay patients. You can think of us as a referral service for direct pay patients, and payment assurance. The how, the what, the why, this will all make more sense as we go through this presentation. Next slide, please. So it is against this backdrop, which is being explained by this slide, that the Kumba team really fell in love with the problem that we wanted to solve. Above the blue line are the issues that we tackle on behalf of the healthcare provider, the doctor in most cases. Being in network with health insurance plans used to be really the go-to formula for providers to acquire new patients. For 50 years, this worked, but now increasingly the economics that the providers are experiencing doesn't work for them. They're going out of network more and more at the extreme end of the spectrum. They're becoming concierge. But in so doing, that means they need a new primary way to generate to acquire new patients. So that's a big issue for them. The other problem that's perhaps less well known is just how challenging it is for providers in the United States to capture the patient financial responsibility. Most providers in the United States are very good at collecting money from the insurance plan and not so good at collecting the patient financial responsibility. On average, they're collecting about 32 cents on the dollar, and our solution solves that problem as well. Below the line, I'm discussing what Kumba Health is doing for the consumer or for the patient. High deductible insurance plans are here to stay, and that means consumers are going out of pocket more often and for larger sums of money than ever before. The concept here is that under this paradigm, consumers need to know the cost of services in order to become better shoppers. In order for this marketplace to work for the first time ever, a consumer needs to know what something costs. Price transparency is now imperative. Next slide, please. So this slide really repeats what I just described. I put this into the deck for those of you that want to go back and look at this when there isn't a talking head there. But this is in essence restating what I just said in the previous slide, but more in long form. Next slide. The slides here depict the consumer experience, the user experience the consumer has at KumbaHealth.com. On the left-hand side, it shows the consumer finding the website and coming up to a directory of providers based on a search the patient is doing around medical specialty and geography. So he or she might be looking for allergists in a particular area code, city, region of the country. And it brings up a handful of doctors that meet that criteria. On the right-hand side, what's happening is they're drilling down into a particular provider that they've discovered. Most importantly, they're able to view that provider's listing of services. So the common services and procedures that medical treatments that particular provider provides. And most importantly, their Kumba or cash price. And that's really the differentiator in the user experience here. They're not just able to learn more about the doctor in a Yelp-like way. They're able to ascertain exactly what services that provider provides, along with the Kumba price, which is the price if they pay cash and don't run it through their insurance that they will provide. And then it goes on to enable them to schedule an appointment with that provider, all in the same transaction. Next slide, please. Once booked, once the patient has gone through the process of finding the doctor, confirming the appointment, which includes the scheduling piece, the last part of it is an actual e-commerce-like transaction where they are paying for the service right there on KumbaHealth.com. Their payment goes in. Technically, what's happening is their payment goes into an escrow account, and that money is then transferred to the provider at the point of service. So in a nutshell, this experience that the consumer or patient is going through on KumbaHealth.com is solving those two pain points that the provider has around lead gen, getting them a new patient, and in particular, a patient that they most covet, meaning a patient that's going to pay direct, and also payment assurance, and not having to worry about their need or failure to collect payment from that patient. And then on the patient side, they're getting the patient transparency. They're getting the price transparency that is really the cornerstone of the Kumba brand. The back end of the entire system, which is what the provider would see, is a back end that enables them to manipulate all of the information that they share with the patient, their hours of operation, their pricing, the services that they list on their site, and any other information that is being presented via the web to the patient. And they can update that as often as they want. Next slide, please. So our journey for Kumba began in Q2 of last year. In less than 18 months, we built the platform, launched the product at the very end of 2015. We've enrolled 100 providers across Los Angeles. Like I mentioned, these are providers across every medical specialty. These are imaging centers, labs, and urgent care clinics. We've put together a seasoned startup team. We've worked on consumer validation, driving patients to the website, scheduling appointments for these patients, capturing payment from these patients. And we've begun a tremendous amount of SEO and test marketing initiatives to really start to crack the nut on the demand side of the marketplace. Next slide, please. The primary way that Kumba makes money is by charging the provider a monthly subscription fee of approximately $350. And for us, and notable, is this is something that's now very common. This really isn't a friction point by virtue of the fact that so many providers now are paying for a variety of different digital services across that are solving different pain points for them. So we're not finding, whereas maybe 5 years ago, this would have, this pricing model might have created some friction with the typical doctor or doctor's office. Today, that really isn't the case. Next slide, please. So this slide and the one that comes up after this summarize what is really a two-pronged strategy for how Kumba is going to market. With individual medical practices, we focus on, given major geographic markets, big cities throughout the United States. We'll do this for about 75 different cities or markets, ultimately blanketing the United States across these big population centers with doctors that are part of the Kumba Health network. Next slide. And then at the other end of the spectrum, we are selling Kumba Health into what I would characterize as really the enterprise healthcare client. We'll be directing our sales and marketing efforts towards medical groups, towards state medical associations, where the sales cycle will predictably be longer, but the result of that sale is a pickup of hundreds or even thousands of providers per success. So in the long run, it's going to be a combination of going after the deep end of the pool through these medical groups and state medical associations, and going one doctor at a time, being more city and region focused. Next slide. And this slide gets really into the weeds more with respect to how we're going about building out the supply side of the marketplace, meaning the doctors, the providers, and the demand side, meaning the consumers and patients. And our approach that we've used both on the provider side and the consumer side to get tactical and actually get providers to sign up for our network and get consumers to discover the website, use the website, become satisfied with the website. Next slide. So competitive landscape wise, in my opinion, really the main takeaway here is that all of these indirect competitors, and probably a lot more that aren't listed here, are essentially paving the way for businesses like Kumba Health, meaning the providers are now, a provider in today's world is almost universally engaged with at least a couple different digital service providers, companies that are in this Kumba Health space. So when we knock on their door, we're not the first internet-based or internet-enabled service that they've looked at, that they're used to taking that knock on the door. And especially good news for us is that we're really the only company in the marketplace right now, the only online brand doing lead gen, doing payment assurance and transparent pricing, vetting our doctors for quality and appointment booking, and doing that all under one transactional rooftop for our providers and for our patients. Next slide. Our team is represented here. On the left is Philip. A couple over is Dr. Trezon. They're the two business partners that put this together. Leo is a clinical chief at Cedars-Sinai Medical Center, which is a big and prestigious hospital here in here in Los Angeles, and is also a private practicing physician. I joined the company about 1.5 years ago, essentially as employee number 1, and have about 20 years of experience working with early stage technology companies, including several in the healthcare arena, typically in the seed to Series B range. 5 of these companies have enjoyed an exit. And over on the right is Marcy, who joined us about 4 months ago, coming from a quasi-similar firm called Spendwell, where she built that firm essentially from scratch with about $18 million of funding behind it. And that's our core team. Next slide, last slide, please. So far and away here, my main goal to get across in this conversation is that we're really interested in attracting some investments from individuals that really have some healthcare experience. That's paramount to us at this stage of development. We've self-funded the company thus far, having spent about $300,000 to achieve the proof points that I've talked about previously. And now we're looking to raise up to $2 million to take the company into a better coverage map for the Los Angeles area, as well as to get out of Los Angeles and start to cover other geographic markets in the United States. Thank you.
All right, thank you, Jay. We do have a few questions. Let's start here. How are you providing a vetting system for patients so they potentially know the quality of a provider?
That's a great question, because to add on to that question, one of the things that we heard over and over and over as we brought on our first 100 providers is, to be very blunt, how are you different from ZocDoc, which most providers at this point, especially those that we're talking to, have had an experience, and typically not a good one. A lot of our providers were ZocDoc customers and now are not ZocDoc customers, mostly complaining about the quality level of that network. So one of our goals from the beginning is to strive to bring in only high quality providers. The question is, how do we decide whether or not dentist A or primary care physician B is quote unquote high quality? We do that by peer referrals. So we require that new members on the provider side of Kumba Health are referred into the network by our current doctors. And we also do that through a algorithm that we use where we take a composite score of all the objective data that we can get on the internet, vitals.com, Healthgrades, Yelp, any place where we can get a rating or a review, and we require that provider to be above a certain mathematical point in the range in order to be part of the Kumba Health network. And that's our 1-2 punch answer to that question right now.
Okay, next question. Where are you getting the data on providers, pricing, references, etc.?
So the providers absolutely set their own pricing. A gastroenterologist that wants to list a colonoscopy on KumbaHealth.com sets their own price. They set their price. They actually provide 2 prices on the back end of the system. Their Kumba Health or cash pay price, that they're in essence selling that service to a consumer that's coming to them through Kumba Health. And they're also listing right next to it what their typical price might be for that service if you were to transact kind of the good old fashioned way. So the consumer is seeing that colonoscopy is X dollars set by the provider, and the quote unquote normal price is Y dollars. The providers are the one that set those pricing. They of course have the same marketplace pressures that any other marketplace would have. They might decide to undercut a competitor. They might decide to go the opposite direction and not be worried about how their price compares to others. Also importantly, we're not looking to have a large number of providers of a particular medical specialty in any given geographic region. So you're not going to search for a dentist in Beverly Hills and find 37 different dentists like you might on other sites. We're going to have 3 or 4 providers per neighborhood, per geography, and that's another way that we're going to differentiate ourselves from the rest of the pack.
Okay, next question. What specialty type of physician do you believe this will resonate most with?
So we've done one thing intentionally with the site, and that was the notion of going very broad. We didn't want any false negatives. We didn't want any false positives as we put this thing out into the marketplace. So we've intentionally gone with almost all medical specialties. We have almost 30 medical specialties covered. We also have labs and imaging centers and urgent care facilities. Because on the front end, when we first started this, the answer is we didn't know. Over time, we've started to learn by virtue of the consumer and the consumer/patient traffic that's gone through the site, those that have scheduled appointments with doctors on our network. We've learned that things like labs are very attractive. Things where the perceived price, the perceived cost savings of going through Kumba is particularly great. And another place that's relatively obvious is things that are not going to be covered by really any insurance product. So any product or any service, treatment, procedure that's going to fall outside the domain of any insurance, whether it's high deductible insurance or low deductible regular insurance, is another great candidate for our service. But it's also a question that we're taking a very careful look at. Every month we review our data to see if we're starting to see Kumba gravitating towards one particular medical specialty or one particular type of treatment or service over another, and then adjust our marketing accordingly.
Okay, we are up against the clock, so we'll go with one last question. There are a few other questions here. Again, we'll consolidate those. We'll get them over to Jay. He'll respond the next 24, 48 hours. If you have additional questions after the presentation or after the event's closed here, again, info@springboardequity.com. Please, in the subject, list the company name that the question is for, and we'll also get those over. So final question, Jay. What is the total addressable market for Kumba?
So I think it's probably easiest answered in two ways. So on the consumer side, it's how many consumers are eligible with this. We look at things and get excited by the fact that the millennials are the biggest generation. We get excited about the 1099 economy, the growing 1099 economy, and all these people that aren't going to be getting insurance in traditional manners. We even get excited in an ironic way about the number of the 29 million uninsured Americans. But the biggest number that we pay attention to on the consumer or demand side of our marketplace are the 120 million Americans now that are on high deductible insurance plans. Those are people that aren't getting the financial benefit of insurance until they hit that deductible. That deductible's higher, in which case they've then reduced the chances that they ever get to that financial benefit. Those are the ones that are coming out of pocket. So it's those 120 million Americans. On the provider side, on the supply side, we look at it as that one slide depicted. We look at it around going after 75 major metro markets here in the United States with about 200 doctors per market. Some cities would be bigger, like a Los Angeles or a New York. Some cities will be smaller and require fewer doctors. But on average, 200 doctors times 75 geographic markets, with some rural areas mixed in. While there might be 220 or 230,000 private practicing physicians in the US, that's probably the addressable market. Our more realistic target is to get about 15,000 of them onto the platform across those 75 cities. And that's really the supply side and the demand side answer to the question.
All right, thank you very much. And that will close our event today. Again, thank you to all of our presenters as well as our audience members. Greatly appreciated. Again, one last time, any questions, or if you want to be connected with or have a conversation with any of our presenters, again, just reach out to us at springboardequity.com or info@springboardequity.com. Most of you also have my personal email, lyle@springboardequity.com, and we will definitely connect you with those presenters. At this point, this wraps today's event. We will have one more event here in 2016. Probably after the Thanksgiving holidays, the first or second week of December. And we hope to bring you a couple more innovative companies at that point. So have a great day. Thank you for joining us, and we'll talk to you soon.